Hi, everyone. My name is Adriana Ibarra. I am a licensed professional counselor in the state of Texas. I have a physical office in Dallas, Texas, as well as an EMDR certified therapist, a registered yoga therapist, a certified hypnotherapist. Additionally, I've done courses in integrative medicine with a focus on nutrition for the treatment of complex trauma and PTSD, and then recently became a nutrition consultant. So I'm going to be talking about the my screening questionnaire, an assessment tool that is meant to help us as clinicians as well as their clients identify the symptoms, the physical symptoms that don't necessarily have a medical explanation and the intersection between their complex trauma and PTSD. So the questionnaire is called the trauma-based assessment, the trauma and body-based assessment questionnaire, or for short, TBSQ. I'm going to start my share. So I'm going to share this. So the trauma-based questionnaire, or for short, the TBSQ, was designed for, I'm going to actually turn off my camera to help focus. The TBSQ was designed to track the relationship between trauma and somatic symptoms. It's used to help identify symptoms such as client fatigue, gastrointestinal issues, or muscle tension that don't necessarily have a clear medical explanation. This questionnaire also helps guide clinicians as well as clients to bridge the gap between verbal processing and the embodiment of their symptoms. It ensures that their symptoms are not just dismissed, but rather integrated into the treatment plan. So who is this test designed for? The client population that this is most relevant for are adolescents and adults with trauma histories. We can see this across a lot of diagnostic profiles such as PTSD and complex trauma, as well as symptom disorders and anxiety or depression with some somatic symptoms. It's particularly useful in outpatient settings, so individual settings, but it can also be used in integrated behavioral health or partial hospitalizations. This helps both the client and clinicians identify their body-based patterns and allowing us to create a more personalized care. So the assessment is based on several foundations. So the theoretical approach is that the trauma lives both in the mind and in the body. It is based on the polyvagal theory, which is based on how the vagus nerve influences our stress responses. It's also based on the central nervous system that a lot of our clients that struggle with trauma report always feeling stuck. So feeling like they're in survival mode all the time. It's also based on informed somatic experiencing, sensory motor, psychotherapy, and it allows us to look at the body and as a whole person. So it looks at the mind, body, and nervous system. So some of the clinical relevance that is shown is that patterns are recognized over time. It helps differentiate between trauma-related issues from medical concerns, and it helps us set clear goals for our clients, giving them hope that their symptoms can get better. So it's based on supporting that healing goes beyond just symptom reduction. So the test is formatted and administered via SurveyMonkey through a Likert scale, which also allows for open-ended questions. So they can input something there if they choose to. The completion is 2 to 5 minutes. So it's not a fairly long a test. For my clients, I personally use it at the start of of any new assessment. So at the start of intake to establish a baseline and then follow up throughout the process. The scoring is weighted on responses for combined qualitative and quantitative insight. The test was, the test was designed to be fair and looks at ethics. So the test was designed to be inclusive. It has cultural sensitive language, as well as earlier stated the Likert scale to allow for somebody to be able to answer based on the how they feel. So likely to unlikely to very likely. The tool is also reflective and non-judgmental. It's confidential and it's meant to be a tool as clinicians and therapists collaborate together. Some of the adaptations for the populations is that it focuses on universal sensations. So pain and fatigue and tension. Pain anywhere can signify the same thing. A headache signifies the same thing across cultures. It translates culturally, not just literally. So it's also supported, it supports interpretations, visual and delivery can be used as the same. It's also framed as a collaboration rather than a client doing something like they could be doing something wrong, potentially causing mistrust. So it's looked at as another tool to help the client build trust and look at the relationship as a very collaborative versus a patient-client relationship. So some of the psychometrics, it has strengths where it is reliable, and that's done by ensuring the consistency of the Likert scale. It's also valid by providing grounded content based on trauma research. And it's constructed on the trauma mind body impact. It also aligns very much with the DSM through the diagnosis of PTSD and complex PTSD clusters. It's also sensitive over time. As many tools, like any tool, there are strengths and limitations. The TBSQ strengths is that it is flexible. So most of the patients complete it within 2 minutes. It tracks both trauma in the body as well as somatic domains. So it looks at how somebody is physically feeling can be impacted by how they're emotionally feeling as well. It's also flexible and allowing us to have a baseline and then continuing to report any changes throughout that time. Some of the limitations are that it's self-reporting. So some of the time this could be a great tool, but some of the time it can fluctuate between how the patient is feeling, how they're interpreting their feelings, how, depending on their mood, depending on what is going on in their life, it could potentially be subject to interpretation, different interpretations. So some of the symptom fluctuations, again, based on mood, as well as cultural differences in expression. So although a headache means a headache, maybe I had a friend of mine say that he believes that he stayed up late and or he couldn't sleep because of a religious component. So it can be sleep disturbances or something like sleep disturbances can mean something different. He felt it got him closer to God. So we still need to continue to provide more, to do more of this examinations to help create the validation needed to make this more effective. So here are some of the symptoms that were endorsed. The top one was feeling exhausted even after sleeping. So people across a lot of, depending, it doesn't matter if domains or cultures, they reported that is the number one thing. A lot of people feel constantly tired. And for our work, we know that it's related to just unprocessed trauma, just staying in the body. But it helps at least provide a better explanation for that. So some of the statistical summaries are they had based on 25 people who answered the questions, there was a median a mean of 2.29, a mode weighted average of 2.71, and a standard deviation of 0.36. So what does this mean? So most people endorsed that they had some sleep disturbances, as well as intrusive thoughts, avoidance, and connection. They had some moderate unwanted memories, feeling on edge, feeling disconnected, and on the lower end, physiological reactions. So the TBSQ focuses on four main domains: sleep regulation, intrusive thoughts, concentration, body-based interventions. So here we can look a little bit more on what it consists of. But before we do that, here is a QR code if you wanted to look at the survey and take it yourself or give it to one of your clients. Here is the QR code for that. So the TBSQs, somatic symptoms, questions are follows. So do clients feel exhausted even after getting 8 hours of sleep? So after waking up in the morning, do you just feel exhausted? Do they have pain in muscles and joints without clear medical explanation? Is there frequent headaches that are hard to explain? Is there some somatic distress without any clear medical issues? So this is meant to address some of those people who constantly report just feeling bloating. They go to the doctor, but they don't necessarily find anything. I had a client recently who reported feeling numbness and tingling in their legs, and they went to the doctor for 8 months, and they didn't have any type of medical reason. Doctors, specialists, she went from a primary to a specialist to they looked at her heart, they looked at her endocrine system, they looked at everything. They looked at her central nervous system, they looked at her GI, and they could never find an explanation to the numbness. And to this day, they can't find an explanation. So she would be a very appropriate candidate for that. Additionally, the TBSQ looks at sleep and concentration. So it looks at, do people have difficulties falling asleep? Do they have, maybe they fall asleep, but they don't stay asleep? Do they feel restless throughout the day, throughout the night, throughout the day? Do they feel more energized at night? Do they feel like they get their second wind at night? It looks at nightmares and sleep disturbances. It looks at, do people have difficulties concentrating and focusing on tasks? Do they have difficulties remembering? Additionally, the TBSQ looks at intrusive and avoidance thoughts. So, do they have unwanted memories and traumatic events? Is there any intrusive thoughts that are hard to control? Do they avoid reminders of places, people, or activities? Do they have difficulties talking about trauma related experiences? I have a client that I used to work with. We worked for a couple of years together where she would avoid the city of San Antonio because she had an ex-boyfriend. She had an extensive history of trauma, but she had a lot of trauma related to him. So with him, there was some sexual abuse, there was some emotional abuse, a lot of emotional abuse. So anytime she even thought of going, she would have these physical heart racing, the intrusive thoughts that were hard to control. So in order for her to deal, she completely avoided the city. The TBSQ also looks at hyperarousal and reactivity. So do people feel on edge, or do they feel hypervigilant? Do they easily get startled? So I had another client who reported that it didn't matter if somebody would open the door without her knowing, she would just become jumpy and easily startled. She would have an exaggerated response. Are people feeling angry or irritable? Do they have a heightened psychological reactivity? Do they have difficulties? Is their heart racing? Do they have trembling? I had another client who reported just constant feeling like an elephant was in their chest, so just constant chest pain. So the TBSQ looks at all that. And finally, it looks at mood and cognition. So do people feel disconnected from themselves, from others? Do they feel emotionally numb? Do they have negative self-beliefs that are rooted in the negative core beliefs of EMDR. I am worthless. I am broken. I am not good enough. Do they have feelings of guilt or trauma or shame? Do they feel loss of interest at things that they used to do? Do they feel detached from themselves? Do they feel detached from others? Do they have difficulties experiencing positive emotions? I had another client who had PTSD early on in his childhood. He even went to prison, and he would report that he never really felt happy. He would always feel pretty neutral or a little glimpse of happiness, but it didn't feel like it was appropriate. Even at his wedding, he didn't feel truly happy. So it looks at all of that. To conclude, this test helps establish a baseline that we can monitor as clinicians throughout treatment. It also ensures that we can track our moods, can track if there's any relapse or if people are plateauing over time. Ultimately, it enhances the treatment, trauma-informed talk therapy with somatic interventions, and it straightens the mind-body connection, so providing more sustainable healing. So let me stop sharing. Hi, I want to thank you guys for coming, listening in to my TBSQ presentation. If you're interested in knowing more information or you have any questions, feel free to contact me at adriana.ibarra.lpc@gmail.com. Or if you're interested in becoming a client, please feel free to contact me at my Psychology Today page, or you can email me directly at adriana.ibarra.lpc@gmail.com. Thanks for listening.